The hand is a complex structure of bones, ligaments, and muscles that allows us to perform a variety of tasks, anywhere from simple functional movements such as writing to fine, intricate movements such as finger touching. So let's get to it.
The hand is comprised of 27 bones altogether. The wrist is composed of 8 bones called carpals. They articulate the ulna and radius and arrange in 2 layers, distal and proximal. The distal arrangement includes the scaphoid, lunate, pisiform, and secretrum. The pisiform is a sesamoid bone, meaning it is embedded in a tendon and sits on top of the secretrum. The proximal arrangement includes trapezium, trapezoid, capitate, and hamate. The palm of the hand is comprised of metacarpals of the first to fifth digit. The phalanges make up the fingers of the hand, and these are divided into proximal, middle, and distal phalanges from digits 2 to 5, and are divided into proximal and distal phalange in the first digit. The bones of the hand are connected via joints. The carpo-metacarpal joints connects the carpals to metacarpals. The metacarpo-phalangeal joints connects the metacarpals and phalanges, and finally the interphalangeal joints connects the individual phalanges to one another.
So there are four groups of muscles in the hand, which are the interosseous, lumbricals, short muscles of the thumb, and little finger. There are seven interosseous muscles. They are divided into these dorsal ones and 3 palmar ones. The palmar interosseous muscles originate on the surface of the metacarpal bones, while they insert on the lateral side of the digits and the base of the proximal phalanx.
The palmar interosseous muscles adduct the digits of the hand. It means the digits move towards the midline of the hand.
On the other side, the dorsal muscles have 2 heads, which originate from adjacent sides of the metacarpal bones and insert on the ulnar side of the proximal phalanx.
Dorsal interosseous muscles abduct the digits of the hand. That means they move them away from the midline of the hand.
Each lumbrical muscle arises from the side of one of both of the adjoining flexor digitorum profundus tendons. The lumbricals pass in front of the deep transverse metacarpal ligament. They insert on the radial side of the extensor mechanicus, just distal to the interosseous tendon.
The lumbricals aid in the flexion of the metacarpal joints and the extension of the interphalangeal joints. They both work in fine movements such as writing.
Adductor pollicis has 2 heads, a transverse head and an oblique head. The transverse head arises from the third metacarpal, and oblique head arises from the base of the second and third metacarpals. Adductor pollicis transverse and oblique insert on the medial side of the base of the proximal phalanx of the thumb.
The opponent's pollicis opposes the movement of the thumb when there is the thumb touching the tip of the 5th digit of the hand.
On the lateral side is abductor pollicis brevis, and medial to this is flexor pollicis brevis. Deep to them both is opponent's pollicis. Abductor pollicis brevis arises from the trapezium and flexor retinaculum. Flexor pollicis brevis arises from the flexor retinaculum and the trapezoid bone. These 2 muscles insert on the base of the proximal phalanx of the thumb on the radial side. Opponent's pollicis arises from the trapezium and flexor retinaculum and inserts on the radial side of the first metacarpal.
The abductor pollicis brevis abducts the thumb. It moves it away from the midline of the hand. The flexor pollicis brevis flexes the thumb. The adductor pollicis adducts the thumb. It moves it towards the midline of the hand.
Alright, so these 3 muscles are the hypothenar eminence. On the medial side, you have adductor digiti minimi. Lateral to that is flexor digiti minimi, and deep to them both lies opponent's digiti minimi. Adductor digiti minimi arises from the pisiform bone and inserts partly into the base of the proximal phalanx and partly into the extensor mechanicus. Flexor digiti minimi arises from the hamate bone and flexor retinaculum, and inserts near the abductor on the proximal phalanx. Opponents arises from the hook of the hamate and inserts on the medial side of the fifth metacarpal bone.
The abductor digiti minimi abducts the hypothenar part of the hand and moves the fifth digit of the hand away from the midline of the hand. The flexor digiti minimi flexes the fifth digit of the hand. The opponent's digiti minimi opposes the movement when the fifth digit of the hand touches the tip of the thumb.
Now that we've finished talking about the bones of the hand, we're now going to move on to talk about the nerves and the vessels that supply the hand. The nerves that supply the hand, there are three types. There are the radial nerve, the ulnar nerve, and the median nerve. From our diagram, we can see from the dorsal perspective of the hand, on the lateral side, the radial nerve supplies the 2/3 of the hand on the lateral side of the dorsal. The ulnar nerve supplies the last 1/3 digits on the medial side, and the median nerve supplies the top 2/3 of the digits. On the palmar side, we see that the ulnar nerve supplies the median 2/3 of the digits, and the median nerve supplies the lateral 2/3 of the palmar hand. Now we're going to come into the arteries. The ulnar artery branches off into a superficial and deep branch and ends up at the superficial arch. The ulnar artery also breaks off into a deep, superficial and deep arch and ends up at the deep arch. And the veins of the hand run very closely with the nerves of the hand.
Okay, buddy.
Ah, man, that really hurt.
I'm Dr. Kemp, and today I've got some pretty bad news, buddy. You've actually got a fracture of your distal end of your radius here. It's actually called a Coles fracture. It's also known as dinner fork deformity. It usually happens in patients that have osteoporosis, usually in the elderly. But in your case, due to the amount of force you landed on your wrist, false fracture as a result. So there are a few treatment options, and let's get into it. You can see here, you've got an acute fracture of your distal end of your radius. I will have to perform a close reduction technique, which basically means I'll have to realign your bones under the skin. It may take around about 6 to 8 weeks of recovery. Good news is I don't have to refer you to the surgeon because I don't think it's that bad. But next time, just be wary of people wearing Crocs, okay? As stated in the question, carpal tunnel syndrome is caused by the compression of the median nerve at the carpal tunnel. It is an idiopathic condition, which means no one actually knows the origin of the condition. If left untreated, it can actually cause atrophy of the thenar muscles. And a handy acronym to address this would be meatloaf. And meat meaning median nerve, loaf meaning lateral two lumbricals. And the O, A, and F, we have O, our opponent's pollicis. We have A, our abductor pollicis brevis, and our adductor pollicis. And then we also have our flexor pollicis longus and brevis. There are two treatment options for this condition. We have a non-surgical approach and a surgical approach. The non-surgical approach involves physical therapy, which can be undertaken in a physiotherapy clinic. And basically what they'll do is promote stretching and range of motion exercises. There is also a surgical option, which basically involves slicing the flexor retinaculum and relieving pressure to the median nerve.